Thank you for your interest in the MAPLE system, the most innovating system for pelvic floor rehabilitation. The MAPLE, the pelvic floor in high definition. The right diagnosis and targeted treatment. With the MAPLE, you will understand the pelvic floor. This part will show you how to clean the MAPLE after use. After the treatment, you can disconnect reference cable and probe cable from the handheld by using your elbow to hold the handheld in place on the treatment couch or by asking the patient to assist you. Remove the reference electrode from the hip bone with your gloved hand and disconnect the cable from the reference cable with your ungloved hand. Throw the snap electrode away and place the cable on the side. Remove the probe from the patient with a gloved hand, but leave it on the probe cable and hold the probe and cable at the connector with your gloved hand. Wipe off cable and probe with a clean tissue with your ungloved hand and throw this tissue away. Rinse the probe, still attached to the cable, under lukewarm water and rinse off probe and first 20 centimeters of the cable while holding it with your gloved hand. Dry probe and cable with a clean tissue and throw this tissue away. Put alcohol 70% on a clean tissue in your ungloved hand and disinfect the probe for 30 seconds while constantly keeping the surface wet with alcohol. Remove the probe from the cable with the tissue while holding the cable with your gloved hand and put the probe in the cap of the probe container and let it dry. Put alcohol 70% on a clean tissue in your ungloved hand and hold the probe. Remove the glove from your other hand to hold the end of the cable. Disinfect the first 20 centimeters of the cable for 30 seconds while constantly keeping the surface wet with alcohol. Throw the tissue away and let the cable dry.